on health is hearing the state of health systems in Mpumalanga, KwaZulu-Natal and Eastern Cape provinces. Health Minister Aaron Motsoeledi acknowledged in his budget vote that health services in the country are in crisis. Well, Abra Barbier is our reporter in the mother city. She was at Parliament today. She joins us live from Cape Town now. Good afternoon, Abra. So many feeling, or the overriding feeling, that those in the corridors of power are failing people when it comes to delivering quality healthcare services. What are some of the key concerns or issues that emerged from this meeting today?
Krishni, good evening. I'm hoping you can hear me. The sound is quite bad on my side. But so what happened was the committee decided to call 3 provincial departments because they want to get to grips with what exactly is happening in the health department right now. As you know, there have been reports that the department is in a crisis. So committee members want to know what the situation is and what they should be doing in terms of their oversight capacity. When the chairperson opened up the committee, the first thing she asked officials, she said, please just be honest with us. We are not here to judge you. We are not here to scream at you, but we need you to be honest with us so that we can also be critical, and that we can look at where steps need to be put in place. Because of course, as you know, this portfolio committee, they have oversight over the health department, and they have to hold officials to account where they need to be held to account. So first up was Mpumalanga, and the MEC for Health in Mpumalanga, he opened up by saying the situation in the Mpumalanga Health Department, it's not good right now. And he cited a whole bunch of reasons qualifying that statement. He spoke about service delivery protests because staff members are up in arms. Staff members are just so tired of the situation that they have to work in. Staff members don't want to work overtime. They don't want to work night shift because they are coming under regular attacks by community members who come to the various hospitals and clinics for health services. And often many of them come, they're frustrated because they have to wait for up to 5 hours for services. Some of them come, they're drunk because they come there over weekends from taverns, and then they become violent with staff members. And because of poor security, their staff members are under attack. And then of course, I don't know if I mentioned that staff members themselves are protesting as well. So there are a range of issues that are coming out of Mpumalanga. We also heard about the poor emergency medical services being offered to people, and people often die waiting for emergency services to be dispatched. We heard about the ratio of ambulance to community, and the ratio, it's completely disproportionate. So this is what we are hearing coming out of the committee at the moment. When I left, they were on a break because MPs had posed questions to the Mpumalanga officials, and right now Mpumalanga officials are answering, they're responding. Many of those responses will be in writing. It won't necessarily be orally tonight because we still have the Eastern Cape Health Department who have to come and brief the committee, as well as Gauteng. Kirshni?
Abra, one wants to gauge a sense of how the MECs of health of each province, if they were there, or officials they sent, how did they fare when it came to questions around staff constraints, long queues, rudeness by staff, poor management of patient complaints, some of which you've already mentioned, and was that accountability or that honesty that the South African public urgently needs, was that forthcoming today, Abra?
They didn't, in the presentation itself, they didn't address those specific issues. Some of those issues were, however, raised in the questions. One MP said that, I think it might have even been the chairperson of the committee, mentioned the fact that nurses are so rude and nurses treat patients with so little respect. And she wasn't only speaking about the hospital, she was also speaking about the clinics. Another issue that came up was the lack of privacy for HIV patients. Like somebody would just stand up and say, everybody who's here for HIV treatment, can you go stand in that queue over there, please? So those kinds of issues were raised in the questions, not in the presentation. So obviously we will get responses to that as officials do come forward with those, like I said, they might be in writing, they might give those responses tonight, but those things will be addressed. I think the other question here, we spoke about the rudeness of staff and then the waiting period. It's a massive issue. The department did acknowledge it. They say that they are working on the situation. What they are finding is that community members are coming straight to hospital instead of first going to the clinics, which is where they should be going for their first line of care. So they, instead of going to a clinic for something like a flu or a minor issue, they would go straight to the hospital where more serious cases should be referred to. And they say this is also all leading up to the backlogs, and they say they are trying to manage this better. Kirshni?
Yeah, well, most people will flock to the hospitals rather because most of our clinics are understaffed and understocked when it comes to the life-saving medication that is needed. I wonder, Abra, if there was any focus on KZN today at all, because that is a province that's also beset with challenges in the public health domain. And we've had reports that 5 hospitals in this province in particular were placed under national administration. This is RK Khan in Durban, Northdale in Pietermaritzburg, Ngwelezane in Empangeni, Murchison in Port Shepstone, and Ladysmith Hospital. Can you tell us anything on that note, Abra?
Unfortunately, I can't. KZN is not on the list tonight, so their issues were not raised at all. In the opening remarks, when the chairperson opened up the meeting, she spoke generally about the problems happening nationwide. We know about the ongoing issues at KZN with the oncology department, that unit, but in tonight's meeting specifically, we are focusing on 3 provinces only, and that's Gauteng, Mpumalanga, and the Eastern Cape. When they wrap up later on, they might do an overview. I'm talking about the committee, not the departments who are here. The committee might do a wrap or an overview of the situation, but to date, till now, they started at 2:30. KZN hasn't come up at all, and obviously we will be following the committee schedule to see if a meeting with KZN has been scheduled for the next week or week thereafter. Kirshni?
Thank you, Abra Barbier, our senior reporter, coming to us from the mother city there. She's, of course, been following the Portfolio Committee of Health, that work with the provinces and various MECs and officials in the provinces for most of today. That committee due to sit till 9 p.m. tonight.